Heart disease is the #1 killer of both men and women in Kentucky. We still live in a tobacco-dominated state, and so I still have a lot of smokers as patients and a lot of people with genetic risk factors, family members who've had heart attacks. Generally, people are sent to me for something that's found in their primary care doctor's office, or they're sent to me because of symptoms, and those might include chest pain, shortness of breath, or heart racing symptoms. I like to divide the heart into 3 sections using the house as an analogy: the plumbing system, the foundation, and the electrical system. The plumbing system would be evaluated on a stress test, so that's looking for blockages. A stress test involves walking on the treadmill, and then we look at the heart before and after with different types of pictures. If you have a murmur or a structural heart problem, that's evaluated on an echo, which is an ultrasound of the heart. And then a heart monitor looks at the electrical system of the heart or heart rhythm issues. If you're getting a heart monitor, it's usually a wearable patch, a sticker that's placed on your chest, and you usually wear it for several days up to several weeks. I've got a lot of patients who are motivated after finding heart disease, who go to cardiac rehab programs after a stent, who really get better exercise endurance, who get better with their shortness of breath, and they do well after that.
Coronary artery calcium scan is a special CAT scan that looks at the plaque buildup in a patient's coronary arteries. And we decide when a patient may benefit from a CAC when they have risk factors associated with cardiovascular disease. Such risk factors may include obesity, hypertension, hyperlipidemia, diabetes, or a family history of heart disease.
The higher a calcium score is, the higher a person's risk of future cardiovascular events. A score of over 400 is a high calcium score and correlates with a high risk of future cardiovascular events, typically within the next 5 years. If someone comes back with an elevated coronary calcium score, it can, one, prompt us to take additional medications such as statins to help lower LDL and reduce inflammation. Another big aspect that it can change is someone might know more about the risk, know that there's atherosclerosis there, and prompt them to make lifestyle changes. So better diet, more exercise, etc.
So for any patients that are on the fence about having the CAC scan, it is a pain-free exam. It helps us to minimize those risk factors earlier rather than later.
Heart disease is the #1 killer of adult men in the United States. And when we talk about the cardiac-related deaths in men, in many instances, what we are talking about is heart attacks and the complications that arise from a heart attack. The most common symptom that we typically encounter is chest discomfort. Other patients may experience shortness of breath. They may experience a sense that their heart is racing or beating irregularly. One of the things that we try to get out as a public service message to the community is the importance for men to seek medical attention as early as possible.
I think Baptist Health Lexington is an excellent facility because of everything we have to offer heart patients. So we really can treat every cardiac diagnosis here, and we have advanced procedures that can take care of blockage in the heart, blockage in the legs. Bypass surgery is sometimes necessary, and we have the surgeons here to do that. I think the patient should care that Baptist Health Lexington is accredited because it really is a stamp of approval. You know that this hospital has been accredited and vetted by an outside organization, and that we have met those highest standards nationwide. So they can trust that all members of the care team, their bedside nurse to every doctor they encounter, is living up to those high standards. And that really translates into good care for them and efficient care. It also means that this hospital has ongoing processes that look to improve every part of our care to the patient. So we're collecting data all the time and looking at ways we can improve patient care. For me personally, and thinking about my own family, when I'm looking to recommend a hospital or a place for my family to go, I look for a hospital that's comprehensive, that really can treat the patient from A to Z, and Baptist Health Lexington has that.